A patient sits across from me and says, "Doc, I thought it was just Kratom." He started with Kratom powder for back pain and stress. Then he found little bottles labeled 7-OH at a smoke shop. They worked faster, felt stronger, and seemed legal. But when he tried to stop, he had sweats, body aches, anxiety, insomnia, and cravings. His body was in full opioid withdrawal. That's the part most people miss. Kratom and 7-OH are related, but they're not the same risk. Whole leaf kratom mainly contains mitragynine. 7-OH, or 7-hydroxymitragynine, is a much stronger opioid active compound that shows up in some concentrated products at levels far beyond the natural kratom leaf. I'm Dr. Zaid Fadul, board-certified family physician, Air Force flight surgeon, and founder of Bespoke Concierge MD. Over the next 10 minutes, I'll cover the real kratom side effects, why 7-OH is different, what labs to monitor, and who should avoid these products, and what dependence actually looks like. Stay to the end because I'll give you the short safety checklist I use when a patient says, "Doc, I'm using Kratom and I want to make sure I'm safe." Okay, let's dive in. Let's start with the most searched question. Is 7-OH the same as Kratom? Short answer, no. Kratom comes from the mitragenous speciosa plant, and its main alkaloid is mitragynine. That's what most traditional Kratom users are taking. In the natural leaf, 7-OH is only present in tiny amounts, and your body makes a little more when your liver processes mitragynine. That's why these products can call themselves natural. But many modern 7-OH products, the shots, the gummies, the tins you've seen near the gas station register, aren't just strong Kratom. They're concentrated or semi-synthetic, with 7-OH levels far above anything in the plant. And 7-OH has much stronger opioid-like activity, which means higher risk for respiratory depression, abuse, dependence, and withdrawal. Think of it this way. Kratom leaf is like coffee, and concentrated 7-OH is like a scoop of pure caffeine powder. Same family, totally different danger level. So what are the actual side effects? Kratom side effects can go in two directions because dose matters. At lower doses, people often describe stimulant-like effects, more energy, more alertness, and sometimes less pain. At higher doses, the effects can become much more sedating and opioid-like. The most common Kratom side effects in poison center data are agitation or irritability, fast heart rate, drowsiness, nausea, and confusion. Less common but serious problems include hallucinations, seizures, respiratory depression, coma, and rare cardiac or respiratory arrest, especially when mixed with other substances. That's why the internet is so confusing. One person says it helped them focus, another says it made them sick, another ended up in withdrawal. They can all be telling the truth because the product, the dose, and the mix change everything. There's also a liver concern. Kratom has been linked to liver injury with a cholestatic pattern, meaning biofluid flow gets impaired. Watch for yellow eyes, dark urine, itching, pale stools, fatigue, or right upper belly discomfort. And here's a bridge most people miss. The danger isn't only Kratom itself, it spikes when the product is concentrated, mislabeled, or mixed with other drugs. Here's where the safety conversation changes. With whole leaf Kratom, mitragynine appears to have a ceiling on respiratory depression in animal studies. The breathing slowdown doesn't keep worsening as the dose climbs. 7-OH doesn't play by those rules. It causes dose-dependent respiratory depression. The higher the dose, the more your breathing slows. 7-OH was more potent than morphine for reducing breathing, though that effect is reversible with naloxone. That's a big deal. Mix 7-OH with alcohol, benzos like Xanax, sleep meds, or pain meds, and the risk stacks fast. Think of breathing like an airplane's autopilot. Regular Kratom might nudge the controls. Concentrated 7-OH can push the system towards shutdown, especially with other depressants on board. One more thing that should make you angry. Testing has found some products contain far more 7-OH than the label claims. You generally don't know what dose you're taking. So here's a safety point worth pausing on. If you or someone you love uses 7-OH, keep naloxone, aka Narcan, on hand. It's cheap, available without a prescription, and it works on 7-OH. That's why 7-OH isn't just another supplement. It's an unregulated opioid active compound with unpredictable dosing. Which raises the question, who should avoid it entirely? If you have liver disease, Kratom and 7-OH are a bad idea without medical supervision. Liver injury is one of the best documented risks. If you're pregnant or breastfeeding, avoid it. Kratom use in pregnancy is linked to newborn withdrawal. If you have epilepsy, be cautious. There are reports of breakthrough seizures, and Kratom can interact with seizure medications. If you have heart rhythm problems, prolonged QT, or fainting spells, that's a red flag. Kratom can affect cardiac potassium channels and has been tied to fast heart rate and QTc changes. If you have kidney disease, caution is reasonable too, though the evidence is thinner. And if you take prescription meds, opioids, benzos, antidepressants, statins, blood thinners, seizure meds, immune suppressants, or heart medications, don't combine them casually. Kratom affects the CYP3A and CYP2D6 pathways that control how your body handles those other drugs. And for athletes who are interested in using it for performance or pain management, watch my video on its impact for athletes linked above. Hang with me here, because that safety checklist I promise is coming, and this next part is exactly why you'll want it. If you're thinking, I use it, but I feel fine, feeling fine isn't the same as being safe. There are no formal guidelines to monitor for Kratom side effects, so any plan is built on the known risks and expert judgment. If someone is using Kratom regularly, I start with the liver, either a full liver panel or CMP, because Kratom injury often shows up in those numbers before you feel anything. Next, a kidney panel with a urinalysis, since kidney stress can be silent early. Then, depending on your dose, symptoms, and medications, an EKG to check your heart's rhythm. And finally, a careful medication and supplement review. And one more point, standard urine drug screens do not reliably detect mitragynine or 7-OH. If testing is needed, it usually requires a specialized Kratom-specific assay or LC-MS/MS testing. But labs only tell part of the story. The bigger question is what happens when someone tries to stop. Yes, Kratom can cause dependence, and it's more common than most users expect. In US survey data, most active Kratom users met the clinical criteria for Kratom use disorder, though for many it was on the milder end, driven by tolerance, cravings, and withdrawal rather than a lost job or a DUI. Kratom withdrawal feels like opioid withdrawal. Muscle aches, insomnia, diarrhea, watery eyes, runny nose, anxiety, and low mood, often starting within hours of the last dose, especially if you're dosing several times a day. This is the same territory I cover in my video on using Kratom to get off opioids, linked at the end. 7-OH dependence hits harder. One case report described a man escalating to 360 milligrams a day and then needing Suboxone and supportive medications to get through withdrawal. Let me be clear, I get it. For a lot of people, this started as a real attempt to manage pain, anxiety, or getting off something worse. My message isn't you're bad if you use this, it's this: don't confuse legality, availability, or the word plant with safety. Let's pull this into a checklist. Here's the bottom line. Whole leaf Kratom carries real risks: nausea, fast heart rate, sedation, liver injury, seizures, heart rhythm concerns, drug interactions, and dependence. 7-OH side effects raise the stakes, behaving like a potent opioid with unpredictable labeling, strong dependence, and more severe withdrawal. If you use either one, the safest next step isn't shame or guessing, it's a real plan. Liver and kidney labs, an EKG when appropriate, a medication review, and a stepwise taper if you want to cut back or stop. That's exactly why we built Bespoke Concierge MD. Direct access to a physician, personalized lab monitoring, careful medication review, and guidance that isn't rushed. If you want a doctor who understands the science and the real-world use and who won't judge you, click the link below and join the practice. Membership spots are limited. Let's replace guesswork with a plan. If this helps, send it to someone who thinks natural always means safe. Because in medicine, the real question is never just, does it work? It's, does it work for you safely? If you're struggling with opioid addiction, the video on the right covers Kratom as a potential way to get off opiates. The playlist on the left covers Kratom and 7-OH topics in detail. And hit subscribe. I publish evidence-based medical content every week that could change your life. See you in the next video.